Welcome to KB Diamond's Edu Consult. This edition is a follow-up on the talk that I had on caring for newborn baby. In this edition, we'll be talking more on postnatal care, all that a mother needs to know. Generally, we're talking about child care, and we'll be looking at few things we need to do as a mother in taking care of our newborn baby. Piercing of the ear of a female child. I will advise, if you are going to do it, it has to be within 1 week. Once you made up your mind she's a female, you pierce the ear within a week, and all you need to do is just to use the methylated spirit to clean it, and that is all. And perhaps it's become septic. You can use if you have the lantern. In Africa, we use the head of the lantern with a clean cloth. You keep on using it to press it until the wound, has finally gone. If it's not septic, all you need to do is just to apply methylated spirits and to use oil in the hole and keep rolling it to make sure that the pain. Of course, if you are going to use an earring, it has to be a sterilized earring, stainless one. Number 2 is circumcision. And for the male, we are circumcised. When we have a male child, I will advise you do the circumcision within 2 weeks. In some part of Africa, the children are grown up, some 5 years, 6 years. It's a form of a tradition. They're going to do through a very big ceremony to circumcise the child. But as far as modernization has come in, it is advisable, and some normally do it. You do the circumcision within 2 weeks, but some even do it immediately after the 8 days. And all you need to do is you just make sure that that region is kept clean. If the child poo, you clean up, wash up, clean up very well, and the organ of the male should not be contaminated with feces, or when you are cleaning it up, it has to be covered up. And perhaps it's the ring type that is used. All you need to do is just use the penicillin to rub around the head of the organ, or you just keep dropping an oil on it, making sure that it's moist. You can change diaper for the baby, and that does not all it needs. It has to be clean, and you don't expose that part for flies to perch on to avoid infection. Another thing is the female organ. The make of the female organ is quite different, and when we have the female parts, you may notice that some whitish organs are coming out of the part. It does not, it's not an infection, it is natural. It will gradually go off. It will start coming out, and within 2 weeks or thereafter, it is gone. All you need to do is that during bathing, just use a damp, warm napkin to keep on pressing it. You can find out that part may look swollen, but after a while, by the time you are using your napkin and the warm water to press a kind of a little massage on that part, after a while it becomes firm, and you appreciate the look of it. The other area is the umbilical cord. The umbilical cord is detached from the placenta immediately after birth, and they clamp it with a clip. You don't force it to cut. It's going to take a while. Some fall off 3 days after delivery, some a week after delivery. All you need to do is just clean around the umbilical cord with methylated spirit. With a cotton wool, you clean around the umbilical cord with a methylated spirit. Perhaps if you find out that particular area is smelling, it means that there is a slight infection. Maybe the child has jaundice. In that case, you visit the doctor immediately. I'll be rounding up this first edition. Watch out for the second edition on postnatal baby care.